So here we are, Mr. President, now 90 days after the health care law was been enacted, signed into law. 90 days ago, this has become law. The White House holding press conferences and again repeating promises to the American people know have been broken. There is a litany of broken promises, and it just seems, Mr. President, that every week something new comes out that the American people look at and say, you know, it's amazing because we saw this coming. And yet this Congress, this Senate, jammed through a bill that isn't going to provide better coverage. It's going to jam 16 million more people onto Medicaid. 16 million more onto Medicaid. And, Mr. President, we know that almost half the doctors in the country don't take Medicaid patients. Now we're seeing more and more people as physicians, hospitals, saying, how do we keep the doors open with what Medicare is paying? So as fewer and fewer physicians are willing to take care of patients on Medicare, limiting their practices on Medicare and on Medicaid, and Congress now stymied with what is known as the doc fix, huge cuts in reimbursement to doctors who take care of our seniors. It's going to be increasingly difficult for the American people to be able to find a doctor. And that's why, Mr. President, I come to the floor with my second opinion about this health care law, telling you it is time to repeal this legislation and replace it with legislation that delivers more patient-centered solutions, delivers more personal responsibility, more opportunities for individuals who take control of their own health and their own care, which is what I tried to do as the medical director of the Wyoming Health Fairs, giving people information they can use to stay healthy, to keep down the cost of their care. Because half of all the money we spend in this country on health care is just on 5% of the people. There are patient-based solutions, allowing people to buy insurance across state lines, giving individuals who buy their own health insurance personally the same tax relief that the large companies get when they pay for health insurance. Deal with lawsuit abuse, allow small businesses to join together to lower the cost of insurance, provide individual incentives for people who do take personal responsibility for their own health. Those are the things that will actually help get down the cost of care. Those are the things that will help Americans stay healthy. But they are not, Mr. President, in this health care law that has been passed by the House, passed by the Senate, and signed by the President. And that is why, Mr. President, I come to the floor this week, as I have week after week since the law has been signed, to offer my second opinion, and that opinion is it is time to repeal and replace this health care law with a law that will work for the American people.